When I was 7, I folded up some toilet paper in the shape of a tampon and showed my mom that I knew how to use it. And she murmured something like, "Oh, you'll need that soon enough. We're not talking about that now." A week later, a book about bodies showed up in my room. We never discussed the subject again until I was 12, and something very odd had happened to me overnight. And I woke her up and I said, "Mom, there's something going on." And she said, "It's no big deal. Go get a pad from your sister." And she rolled over and went back to sleep. Then that evening, we had a very brief and confusing discussion about eggs and zygotes, and I still don't understand. And that was pretty much it. I knew that wasn't the way it was supposed to go. Shouldn't there be a commemorative moment? At the very least, the girls on TV, they would go to the doctor with their mom and then stop off and get a nail polish on the way home, or they'd go to the drugstore and get a little pink box with supplies in it and then skip through a field of lilies. Shouldn't there be some monumental discussion about my entering womanhood? Then one day at 4 p.m., it occurred to me that there was a place where I could tell my story, a place where I and every other American woman had a voice. The Oprah Winfrey Show. It just made sense that Oprah Winfrey, the host of the new Oprah Winfrey Show, would want to talk to me about what was happening in my life. Oprah would announce the day's topic was about teen girls growing up in America, and she'd introduce me as a very special young lady. She'd say, "How do you balance school with becoming a woman? How do you maintain your paper route now that you're a woman?" So right after General Hospital, at the end of General Hospital, it went in, and then the peppy piccolo music and saxophone would start, and I'd envision myself sitting on the gray chair wearing a multicolored scarf and talking to her. Of course, that never happened. My stuff wasn't significant enough to hold an audience's or Oprah's attention, or barely my mom's. It wasn't that I was not important, but these issues were just too small, too mundane, no big deal. In college, the health center was in the center of campus, and I walked by it every day and rarely entered. Once, after I coughed so hard that, this is gross, that phlegm flew out of my mouth all over my lap, like the girl in The Exorcist, my roommate, Christy, said, "Okay, we're going to the doctor." It turns out that I had an undiagnosed bronchial infection that I thought was a cold for several weeks. I suppose I should have sought medical attention before my problem became so awful. But as a family, we never really went to the doctor, so I hadn't developed a barometer for judging what was worthy of attention. So to me, it was no big deal. Not surprisingly, I was hesitant to go to the doctor when I felt a hard protrusion in my lower abdomen area around the age of 35. Sometimes the golf ball size something would be really achy, but I thought, that's normal. And doesn't everyone have shooting pains in their back every now and then? Clearly, nothing to see here. No need to go to the doctor, until the pain became too persistent to ignore. The exam was uncomfortable, but not nearly as uncomfortable as explaining why I had forgone gynecological care for more than 2 decades. The doctor was incredulous as I defended my mother's and then my own lapse. The doctor told me I had uterine fibroids, which, because they are more prevalent in professional Black women than any other group, there are myths online that say that it's linked to hair relaxers, and that's not actually true, because I'm not getting a relaxer. Anyway, in actuality, the growth of the fibroids is reduced by estrogen release during pregnancy, and because professional Black women tend to have children later in life, or not at all, fibroids have a chance to thrive. So, well, lucky me. Because I had waited years to ask for help allowing the tumors to thrive, a hysterectomy was my only option. As the surgery date grew closer, my anxiety grew. At one particular emotional moment, I wondered out loud to my sister what my never-to-exist children would look like. Her reply was, "Oh, they would have been funny looking." That hurt, but I recognized that this was uncharted territory, and the awkwardness was at sometimes overwhelming to all of us. She was making a joke, and I couldn't judge her for that. right? I didn't object and instead absorbed it as one of the disappointments associated with my circumstance. Besides, I didn't want her to think I was too sensitive. On the morning of my surgery, my parents and I drove to the massive UNC medical complex at Chapel Hill, and by 7 a.m., I was ready to go. I remember my parents hugging me and the doctor telling me to count backward from 100. And when I woke up from the anesthesia in my hospital bed, my mother was sitting beside me, rubbing my leg, a calming smile on her face. Her smile never leaving, she said, "Thank goodness this is over. You never have to think of this again, unless you meet a man who wants to have a child with you." I know. I was speechless, but not because of the shock of the wildly inappropriate statement made to a 37-year-old who had had a difficult but unavoidable surgery. No, I was speechless because I couldn't think of anything to say that wouldn't hurt her feelings. Of course, she had hurt my feelings, but that was immaterial. She had driven 6 hours to be with me through the surgery and to help me convalesce. So to snap at her, I thought would have been rude, wouldn't it? The emotional trauma of the surgery was far greater than I anticipated, so I finally sought the help of a therapist, Therapist John. And I call him Therapist John to his face. Through my therapy sessions, it became clear that by spending a lifetime of dismissing what was happening to my life and my needs, I was further diminishing myself in my eyes and others. My fear of being seen as being needy or humorless or rude had led to a life of permitted hurts and inauthenticity. My losses and gains do matter and are worthy of consideration and attention. In the end, speaking the truth about my feelings has made me a better daughter, friend, sister, and teacher. It's freeing. And a hidden benefit is that it allows others to be responsive. And the level of responsiveness is a good measure of who is entitled to be in my life. So now I genuinely do have a story that needs to be shared, and it's not with Oprah, but it is with telling my own story. I have learned that I'm allowed to speak my mind about what is sad, troubling, and mentally or physically painful. Even if it doesn't seem like a big deal, eventually what may appear as minor grows and festers until it is an enormous crippling mass. So it turns out my Oprah story was not one of becoming a woman at 12. It is one of how I am working to be a whole woman, my whole self, every day from this day forward. Thank you.